connect and share the experience helps everyone. So today's event, we have the guest speaker, Dr. Avinesh Bhar, moderated by Dr. Venkatesh. So Dr. Bhar is very busy. He's been in the front line, working at the ICUs, night shifts, and of course, saving lives. So we thank Dr. Bhar and his team and all the associated hospitals, plus all the hardworking healthcare staff at this critical hour. He and his team are currently saving lives and helping hospitals across Georgia, Florida, and South Carolina. He has agreed to take some time off his busy schedule to share his experiences, spread awareness, and knowledge on this critical subject of sleep, COVID-19, and respiratory related issues. So this event is sponsored by TrillionX, a digital marketing and SEO services and marketing automation company for physicians and medical clinics in association with Sleep, which is the first integrated sleep and pulmonary telemedicine practice. Simple set of house rules. So feel free to ask questions in the chat sessions. We may not be able to get to all the chat questions, but please do ask. If there are any personal or need individual attention, we encourage you to schedule one-on-one session with Dr. Bhar on his website, www.sleep.com, as SLIIIP. That's 3 I's in there. There will also be a complimentary sleep test that Dr. Bhar has agreed to prescribe for. So you can reach out in the contact us, or and we'll give you some instructions during the sessions to where he will kind of talk about that. All you require is an iPhone for that, and there's a technology by which you could kind of do it. And it's FDA approved, so a doctor will talk about that. All he requires is the first name, last name, date of birth, and country, and he will kind of tell you those details too, and you kind of directly interact with him to give all your personal details. Of course, everyone new joining in or anybody around, please mute your phone and laptops for any background noises. And without much ado, over to you, Venkat.
Hi, good afternoon, everyone. Thank you for taking time to attend this session. My name is Venkat Bala. I'm owner and founder of VBK Pharma, a health and wellness care provider, mainly involved with the healthcare brands, but most importantly, founder and creator of Mucinex cough cold products in the US. I have US patents and have published data, worked for large multinational corporations, Bayer, Reckitt Benckiser, to name a few. And I have experience both on surface care, personal health, as well as providing solutions for companies that are looking to overcome these challenging times. It's an honor to attend this session. And I would like to discuss and introduce Dr. Avinesh Bhar, who's based in Macon, Georgia, and welcome him to this session. Dr. Bhar, as you're aware about it, has his alma from Washington State University in St. Louis, as well as University of Tennessee, Memphis. He's a Booth School alumni as well from University of Chicago. Given that we are in unprecedented times where our entire life has gone topsy-turvy during this COVID-related shutdown, we have three major principles that are in play. The first one is related to the jobs, the economy. Second one is related specifically to people's and your loved ones' health and well-being. And the third aspect is related to personal well-being and mental health. So an important segue in this discussion is related to sleep, where people have unprecedented times and have high anxiety, because of which it impacts their normal day-to-day routine as well as their sleep pattern. That being said, I would like to hand this discussion over to Dr. Bhar, and welcome, and please introduce the concept that you have presented to.
Thank you. Thank you, Venkat. Yeah, so I think one of the things that we've come across from a sleep perspective has been twofold. One is a personal anxiety related to COVID and how that affects your sleep, the uncertainty related to that, whether your loved ones or you yourself may be infected. It hits home very personally for us, especially on the front lines, just because every time I have a tickle in the throat, it's always, oh shit, this is it. I've got it. And it's thankfully has been a false alarm. And so these kind of personal anxieties does affect sleep. The other aspect that I think gets rather unrecognized is with most of us staying home, our schedules as well have changed. We're not used to the usual day and night variability in our cycles. Most of us are working from home. We have time. We're not expanding our energy as much traveling. There's a lack of exhaustion. We are able to take naps if we want to during the day. Sometimes we are a lot less mobile. And so this lack of sort of day-night sort of variability affects how we're able to fall asleep at night. Most of my patients I've actually come across and spoken through and treated by telemedicine. Main issue seems to be scheduling, which is an interesting thing because most of the time scheduling was an issue when we used to work was related to weekdays and weekends, when your weekday schedule is rather different compared to your weekend schedule. And getting back to work, you'd have something called on a Sunday night, the social jet lag, because on a Friday and Saturday night, you would go to sleep later. And then on Sunday, you try to force your body to go to sleep a little earlier, and your body's not used to it because it hasn't really been awake and hasn't been exhausted enough yet. And so the scheduling has now transferred itself throughout the whole week. And patients that I've spoken to have also had issues when they've gone back to work and complaining a lot more of insomnia and difficulty falling asleep. Then obviously, if you're not falling asleep, your mind tends to wander. And then thoughts about COVID and whether it's safe to go back to work and whether your children, what are they protected? Are your parents protected? And so all these thoughts and the anxiety builds up with that. So I think that's how I've seen a lot of the convergence between sleep and COVID primarily.
So can we launch the polling just to kind of see what is the? I'm just launching the poll. So let's have a quick minute to see what's. So the question is, have you? Yeah, it's pretty. I think it has other few 17 seconds or so. Okay. It looks like we have a good count of.
And I wanted to add as well that in terms of sleep, how it affects us personally as well in terms of our ability to fend off infections. I think we ignore the fact that sleep is an it affects our immune system and it modulates our immune system positively. So if we have good sleep, it protects us from a lot more infections as well. I'm not just specifically talking about COVID-19, but all sort of respiratory ailments and so on. So I think it's important to focus on sleep as we tend to be a little bit more, I guess, flexible in our scheduling. We tend to cheat and maybe sleep sleep late, not get enough sleep, and maybe try to use naps during the day to make up for it. So these kind of issues in terms of your sleep quantity, not only throughout the 24 hours, but making sure that it's consolidated within a 7 to 8 hour time span is extremely important for us to kind of keep our immune systems up. I'm working night shifts right now, and I've personally experienced that as well. And I know this is more anecdotal, but scientifically as well, it's been proven. But anecdotally, when I'm on night shifts and I don't get consolidated sleep, after a week or so, I tend to get a lot more body aches and I tend to feel not well. So both personally, I've even dealt with patients who've told me that as well. So it validates a lot of the research that we find. And sometimes research doesn't tend to reflect real life. But I think in terms of the connection between sleep and your immune system, that's something to take seriously, especially if you do have comorbid medical problems, if you have diabetes, high blood pressure, and ensuring that you get good sleep, good quality sleep is even more vital. Venkat?
Very good. Yes, thank you. Thank you, Dr. Bhar. One of the main aspects, Dr. Barr, is that we are living in a highly interconnected world where, if you look probably 20 years ago, you didn't have social media, you didn't have smartphones, you didn't have 24 by 7 news channels and network that were bombarding you with this information. Are we in a situation of wherein we are in an information overload phase, or is it being compounded by the fact of a pandemic being out there, and it has a synergistic effect in terms of information overload plus the anxiety and stress related to the COVID situation? Could you please elucidate few thoughts about that?
Yeah, no, I think even from a healthcare perspective, the volume of data coming through has been overwhelming for all of us as well, to kind of keep track what's important, what's not, what's noise versus what's actual signal. And so that has been difficult. I think the variety of news channels as well, where you get your news sources from, has also been overwhelming. Some people will rely on friends and family, some social media. And so that has been an issue in terms of trying to figure out what works, what doesn't work. From the healthcare perspective, the rush to produce data has been obviously welcoming, because we need to get as much information. However, the quality of the data may have been lacking. And so there's also the element of human bias. When we interpret this data, we come from different angles, and we have our own biases, we have our own motivations. And so that affects how we interpret the data as well. But I think it's crazy to think just 3 months ago, this was very much a novel disease, and I feel like a veteran now of the disease in just a short 3 months. So it's the amount of data that we've had to digest is overwhelming, and we found there's a lot of issues in the initial data that came out, just because the quality of it, and us understanding how the disease propagates and so on. And I think that will continue to change. I think we like certainty. I can tell you that we're not going to get certainty. The idea is to ensure that we protect ourselves, protect our loved ones. The suggested mechanisms of hand washing and ensuring that you wear a face mask when you're out in public, avoiding large gatherings at this time, especially if you have a comorbid medical condition, is still vital. There's no real silver bullet to all of this. There's recent studies that have actually been encouraging in terms of treatment for COVID, in terms of steroid use, or something called dexamethasone, which is a kind of steroid. There was a study that was done in England, and that has been highly encouraging in terms of mortality benefit. The initial studies that came out for other drugs and so on haven't been all that great, but at this time, we're not holding back in terms of trying to decide what to use and what not to use. We tend to throw the kitchen sink. So my background, being a sleep pulmonary and critical care physician, I work in the ICU as well. So I kind of straddle both worlds. And in the ICU, a lot of the patients that we see are highly ill and on life support or mechanical ventilation. And these patients, we generally will throw the kitchen sink at them. So we'll give them remdesivir, we'll give them convalescent plasma, we'll give them dexamethasone. And if some hospitals have access to IL-6 inhibitors, which is an anti-inflammatory drug, we also throw that at the patient. I think at this point, until we get true data about whether the cocktail works or doesn't, a lot of people are just throwing the kitchen sink at them. So I think there is, that's a problem that we face on the front lines, is that we can't figure out what data is real, what's not. And the general public, I think, is grappling with that even more because of the anxiety related to a lot of the uncertainty, but also the sources of information that you get. So I generally will definitely recommend that if you do have a lot of concerns, is to reach out to your healthcare provider. A lot of practices have also turned on to telemedicine. We've been doing telemedicine even before COVID, but that was more of a personal move in terms of where I thought that healthcare had to go. And that's worked out well so far. So, I had patients who reached out to me with questions, and my biggest takeaway, apart from obviously the general recommendations, which is mask and hand washing and social distancing, is to also set up a plan for you and your family. making sure that you know who your primary care doctor is, making sure that you have your health information in one place, making sure that you relate to your loved ones in terms of if you get sick or if you need to get tested, where can I get tested at? These are kind of information that'd be helpful to get upfront. It reduces anxiety as you have time to plan for something that may happen, where to go to, which hospital to go to if you need to. And so making sure that you have contact with a health professional. I think that sort of planning allows us to reduce some of the anxiety, some of the uncertainty related with COVID. Obviously, a lot of us have access to healthcare professionals as well. So reach out to them and see if they have any additional advice where they can get testing from. Some healthcare providers like primary care doctors and so on are offering COVID testing. Local councils are also offering local testing as well. And also having a plan for home. If one of us feels sick, is to ensure that we take precautions to ensure that the rest of the family doesn't get ill. And I think the biggest thing we've learned, even for me, is healthcare workers tend to be, I think, the biggest violators of this is even if we are ill, we tend not to call out sick when we have to show up to work. Because of the lack of coverage, and we don't want to impose too much stress. The work doesn't go away. I can't delay the sick patient till tomorrow. The patient has to be seen. So a lot of healthcare providers and workers will end up going to work even when they're not feeling well. The biggest, that has, for me, at least personally, I've realized that has to change even for myself, is to ensure that if you are sick, whether you work in an office and so on, is to take it seriously and start taking precautions for yourself, your co-workers, and let them know. And I think the work from home policy now, the advent of that and the propagation of that has really, I think, been a boon in all of this. That has helped people stay at home, stay away. People have enjoyed things that they never knew they enjoyed before, didn't have time to enjoy. And I think that some of the silver lining that will come out of this, whether we'll go back to any state of normalcy after this, I'm not sure. The honest truth is that, I look back at 9/11 as a sentinel moment that changed how we travel, changed how we view different parts of the world. And to this day, that really hasn't changed, and it still affects us. I mean, there's a pre 9/11 how I feel and post 9/11. And I think COVID is going to have a pre-COVID and post-COVID, how we travel, how we interact at work, what choices we make, how we protect ourselves, our loved ones, how we view our health. I think for a long time, we've ignored blood pressure issues and high blood pressure issues and cholesterol issues and diabetes as, oh, I'll take a medication and I'll pop a pill and I'll be done with it. But if you don't address those issues from a health level, meaning that if I have diabetes, yes, I can pop a pill, but what sort of lifestyle changes do I need to make to protect myself? Popping a pill doesn't get rid of the comorbid illness. This is where the three tenets of good health come into play. I mean, no matter what a doctor or a hospital or a nurse can tell you and do for you, we're treating you at the back end, meaning at once you've gone through a lot of other diseases or your disease is propagated. But the three tenets of good health is mobility and eating or nutrition. And mobility meaning exercise or even making sure that you keep moving. Good nutrition, making sure that you eat well, eat healthy, be aware of what you put in your mouth, because whatever you eat goes against whatever you're trying to work off in terms of mobility. So that's a fine balance. And the third part to that, or the trifecta, is sleep. So those three things need to come together. And I think everyone needs to kind of be a lot more aware now of how important health is.
Thank you, Dr. Bhar. That was a very detailed and thorough elucidation of the issue. And you've been one of the pioneers as well as the entrepreneurs in the telemedicine field, and you have this online sleep. It's very elaborate and very highly informative. That is one thing where we as an entrepreneurial community, we look for the opportunities and we see where we could excel and provide a suitable solution. So coming to your product and what your clinic offers, could you please elaborate a little bit about that for the benefit of our audience?
Yeah, so thank you. What I was seeing as well was that we were maybe one dirty secret in healthcare is what we do is not magical. What we do is not rocket science. Um, you know, physician is, or a provider is your healer, and a lot of it is listening and trying to understand what you're going through and trying to figure out how to address that. And so a lot of that can be done via telemedicine. A lot of that doesn't require face-to-face visits. Being based in Macon, I came here a few years ago because of my visa, and I ended up staying. But what I've seen really is I've come across patients who travel half an hour, 45 minutes, over an hour to come and see me. And a lot of this could be done via tele, by speaking to someone and actually understanding what they're going through, and then coming up with a plan for that. So I felt a lot of what I was doing could be done via tele more effectively, and did not need the patient to come in, sit in the waiting room, fill up some paperwork, and then have a 15-minute session with me. Why couldn't I do it over tele? And so I was seeing a lot of trend in terms of telemedicine for primary care, which is your doctor that you go to for coughs and colds and aches and so on, but didn't see that for specialist care. And that's why I felt that we needed to, if we were really serious about moving the medium of healthcare to be a lot more, I guess, democratic in terms of access, the primary care providers online had to be supported by specialists online. And so that's why I brought my specialty of sleep medicine and pulmonary medicine via sleep.com, and to bring that to patients. But I wanted patients to understand that telemedicine is not I guess, a second choice. It is not that, oh, I can't see you in person, hence I'll see you via telemedicine. I wanted to change that paradigm and help patients understand that they were not actually getting second-rate service, but they were getting equal, maybe even more. So I wanted to build a practice that was virtual. A lot of push was for me to set up a physical practice and then add telemedicine. But I think a lot of us know that if you build stuff, if you don't build it with virtual first, your patient touch points or your customer touch points changes, how you view your interaction with your customers changes. So I wanted to make sure that we were online first. And so that's why this online sleep test, for example, we've partnered with the first FDA approved sleep apnea test that can be done by an iPhone. Currently, most sleep apnea tests have to be done by an in-lab study where you have to go into a sleep lab and you have to be all put up with sensors and monitors, and or the home sleep study. However, the online sleep test is I will prescribe you, once I evaluate you and I prescribe you a test, you literally have to download an app and you switch it on at night when it's plugged in, and you switch it off, pause it in the morning, and within 30 minutes, I get a readout of your report, and so do you. And I think that's very important, because I think healthcare has always been sort of a pre-Copernican state, where a lot of it has revolved around the healthcare system, around the physician or the provider, but not the patient. And patient's information, you have to kind of you have to go jump through hoops to get information. But having that information, that report sent to you immediately the same time your physician or your provider gets it, is a huge change. So those are one of the things, or innovative things, that we're trying to do. The other things as well, we bring online pulmonary rehab. So a lot of patients with asthma or COPD or bad lung disease like lung fibrosis require rehabilitation. And most of these concepts have been based in hospitals or healthcare system. They'll have a sort of a gym for pulmonary rehab, and patients would have to travel there. But if you're short of breath and you have breathing problems as well, having to travel 3 times a week to go for a session for 12 weeks seems incredibly torturous for most patients. And so what I want to do is ensure that my patients had access to that online. So we teamed up with a provider based out of actually my alma mater in WashU in St. Louis. And they've brought together physical therapists and occupational therapists and respiratory therapists to come up with a very comprehensive program to provide online pulmonary rehab, which has been great. So I think a lot of my patients now actually have access to more health than they did before, just because we've looked at it from a virtual perspective. And I've been out there looking for, how do we deliver care that isn't second rate, but is actually how people want to, how they would want to receive care in the future, and knowing full well that they have a full compendium of support to receive care regardless of where they are. So I mean, having to take a half day off to skip your work and to see your doctor and so on, I think in a decade will seem like such a crazy idea. But that, I don't want to take away from the fact that in-person visits are still vital. There are patients who are complex who need in-person visits. So I don't want to take away from that, but I think a large portion, and I'm talking about 80%, 90% of healthcare medicine can be delivered via tele. So that's, I think, with COVID and so on, in terms of risk of infections. And it's crazy. Again, most of my patients have lung disease and lung problems, and they'd be in a small little waiting room waiting to see me. And you think to yourself, well, that's a risk to them to actually come in and actually spread the disease as well. So I think COVID has brought that to the forefront of how we should maybe change healthcare delivery, probably for the better.
Yeah, thank you, Dr. Bhar. That's really useful. And of course, this is definitely going to be a game changer. I mean, when you do a SWOT analysis, what are your strengths, weakness, opportunities, and threats? That typically is like a line item in a business plan that is presented to the investor group. But in this particular case, we are living through one of them, wherein there are three main aspects, as I said. One is the economy, second one is the family and the relatives and near and dear. And third is the future, how things are going to happen. And as you said, rightly, 9/11 was a completely different scenario post 9/11 versus pre 9/11. I'm sorry, the air travel in the US. So that being said, what do you say would be the three main areas of focus specific for your particular sleep test that you conduct? I mean, if the people who attend this seminar or who see this video online, what would be their three main takeaway from this? Like, how do they reach out to you and what do they need to do?
Sure. I mean, so you can reach out to me via social media. We're on Twitter. So look up Sleep, SLIIIP. We're on Twitter. We're on Facebook, Instagram. I'm also personally on Twitter. So you can reach out to me at Avibhar, AVIBHAR. And actually, Twitter it cuts both ways. Some people like it, some people don't. For healthcare, it's been huge. You spoke about social media kind of drumming up some of the issues initially in terms of how we get our information. But a lot of the initial alarm bells that were rung for COVID actually came through Twitter, and a lot of smart people who are not with healthcare backgrounds, but people who analysts and so on were starting to look at the data that they were getting and started informing the rest of us that there was something coming. So, I think one of the key takeaways I've taken from that is that social media, while there's a lot of the signal to noise ratio sometimes is poor, if you do follow sources that are reliable, that are smart people that you can rely on as well, that becomes a huge boon. And so I think the information we've gotten as well through Twitter in terms of the vibrancy of the debate has helped. So yeah, so if you want to reach out to me, that's a great way as well. You can even email me at info at sliiip.com if you have any questions. But if you feel like you need to schedule a visit as well, just go to the website, sleep.com, and schedule a visit. And I'll be happy to see you. We accept all commercial payers and so on. So if you or your loved ones have any questions, I'll be happy to go through that with you and see if there's, sometimes it can be a second opinion. Sometimes it's also a concern that you haven't gotten answered. The ability to get a sleep specialist is also difficult because there are not many of us around. It's a rather new field. And so where you're based out of, and you may not have a sleep specialist close by, or you may not have a visit that can be done quickly, either online or just, the waiting period may be long because of demand supply. Going to booth, I think demand supply has changed the way I say that now as well, and think about that. But yeah, so I think, having reaching out to us, if you need any questions answered or your loved ones, we'll be happy to help you with that. We do also produce blogs, so if there's any questions, I try to answer them as well, especially when I start getting questions that I think need to be answered. The idea is I don't want physicians or providers to be gatekeepers to good care. I think we have to democratize access to that. There's never going to be enough providers around for all the illnesses that we face. And so all this worry about shortages and so on, I think it alerts us that we can crank out as many doctors or nurses or nurse practitioners as we want to, but we really need to put information in the hands of the public. And so that's why it's important for physicians and providers out there to actually be a lot more active on social media and be reachable. Even in my old job as when I was employed by a healthcare system, it took me over 6 months to get an email address for my practice, because the number of barriers that I go through and so on just to get an email address is huge. And that was the first thing I said in my practice. I got patients need to get in touch with me. And people are always worried about HIPAA violations, but HIPAA violations really are me, how I deal with your information. Am I sharing that with other people that I shouldn't be sharing that with? And as long as we conduct it over media that is encrypted, so all my email inboxes are encrypted. The telemedicine site as well that we conduct the visit on as well is encrypted. And so you have privacy in that sense. So I think, how we interact with the public is important. So, if you want to reach out to me via social media, that's fine. If you have personal questions as well via email, that works. And obviously setting up a visit via the website as well is equally applicable.
Okay, thank you, Dr. Barr. I would like to open up now for any questions from our attendees. You can feel free to type in your questions in the chat window, and I'll be able to read them out loud for benefit of our online viewers. And we can go through the list.
Okay. And while we wait for the questions, I kind of want to chime in as well. What I found as well when I practice via telemedicine is I actually have more focus on the patient than I did before. And it's because I'm just there talking to you. If I'm in my clinic and I have a waiting room that's full and I have my nurses walking by trying to schedule or talking to a patient or asking for this lab results and so on, my mind is always distracted, always trying to see, oh, there's 5 more patients outside. Ooh, what time is it now? And so all of that sort of pressure actually changes my interaction with patients. So that's something that I really enjoyed about my shift to doing telemedicine, is actually just the one-on-one ability to focus on and listen and heal, hopefully.
Yeah, that is a very good observation, Dr. Barr, because I have seen with the recent electronicization of medical records like EMR and test results, as well as the one-on-one interaction between the doctor and the patient being impacted in a general a physical office environment. When I did do the telemedicine with my primary care physician, I could get his undivided attention for that 10-15 minutes of time, which I couldn't in my previous visits to his office in person. So I could vouch for that and say that, yes, I've had that personal experience wherein the physical presence in a physician office with so many things that are happening outside the office.
Yes, exactly.
It has a very greater impact on the doctor and the physician who's tending to the patient as compared to through telemedicine.
Yeah, and so I think to add to that as well is I think the one of the biggest barriers have been health systems and also physicians themselves not wanting to change, because the current system was set up in such a way that everyone was happy the way things were. Patients were not so much happy, but they didn't really have much of a choice. And I think physicians and providers sometimes give ourselves too much credit in terms of what the physical examination does. It takes away from the actual listening and understanding about what's going on. I'm not saying that we are therapists in terms of just listening, but actually when we talked about focusing on the patient, understanding what their problems are, how we address it actually changes dramatically. When you're in the room as well, when you come in and see a patient and so on, there's the interaction is completely different. When you're doing it by telemedicine, it's also been very different in terms of what I absorb from patients and how we communicate. So I think that has been a new thing. And I think, like I said, the barrier has been mainly a lot of physicians, even that I interact with, don't think telemedicine works. And it's odd because I think they give themselves too much credit in terms of what the face-to-face visit does for the patient. But I think the COVID-19 pandemic, I think one of the silver linings is obviously the fact that people have been forced embrace telemedicine. If you speak to rural health practitioners, they've been doing telemedicine for years, and that's the only way they've had to receive or deliver to care. So they've been on board for a long time. So hopefully this changes the dynamics and allows patients to be, I guess, more. I don't like maybe the word consumerism. Some people find it offensive sometimes in healthcare, but I think it's a good thing when we actually look at a patient and try to figure out what the customer pain points are and how to deal with that best, rather than going, you're patient, I'm provider, this is the relationship, but actually understanding how best to deliver care. So yeah, sorry, we'll go to questions.
Yes, thank you. It's more of a customization and individualization of the patient-physician relationship as compared to a marketization or commercialization aspect of it. I think so. What you're trying to say is the customization for a patient-centric point of view.
Are there any questions that you need me to address?
Yeah, I'm just going through our message boards. I don't see any. And one of the main things that I would like to take
there are questions. Are you able to see now? So there are like 6 questions that have come up. Are you able to see?
Sorry, I'm unable to see that.
Okay, so one is about one of the question is that Dr. Bhar, I'm retired, but I still am experiencing sleep issues, and I can go to sleep or get up whenever I please. Comments, please.
Well, thanks for your question. It's a difficult question to answer with so little information. It depends on what your routine was before, what your routine is now, what medications you're on, what that can affect you. Sometimes the food that we eat can affect you as well. Weight gain can affect sleep as well. And so there's this a myriad of possibilities that affect your ability to fall asleep and stay asleep. At times, as we get older, there are other medical conditions that may come up that cause you to have issues related to sleep itself, whether it's a breathing issue or a neurological issue or pain issues. So these are all symptoms that do come up that affect our sleep. And regarding the sleep test that you asked about as well, it can be done in an iPhone. The reason is it was interesting because why the sleep test that I'm prescribing is, and we're actually, just to give you an idea of how slow doctors are to embrace technology, we're the sole exclusive telemedicine providers of this test. And so what I found out from the owners of the test was that it can be only done on the iPhone because the iPhone is very strict in terms of their sensors and their mic and monitors. What the test does is actually measure or listen to your respiratory effort, and based on that and through an algorithm, determine if you have risk for sleep apnea, whether you're high risk or low risk. And so the Androids, though, comes in various forms and types, and their mics and so on may differ. So the reliability of it or the reproducibility of it was lacking. So that's why it's FDA approved only for your iPhone. But if you all have a family member in your household itself that has an iPhone, you can open the app on that and register on that and use that for your sleep test overnight. So that's one way to address that.
Okay. And that has to be prescribed, correct?
Yes, it has to be medically prescribed.
Yes. One important point that we want to tell all our viewers is that we cannot prescribe anything. We are not doctors, at least myself personally and the host. But what we would like to channel our discussion is that we have a physician. He has worked real time in COVID situation, as well as he has a platform for providing telemedicine. And one of the specific areas is specific to sleep and sleep apnea. So if there is any medical related questions or technicalities, please direct that question to Dr. Bhar.
Yes.
And I'd like to go ahead and address the question as well. When do you advise a sleep test? And I think that's a very important question. It differs in terms of how the issue affects you personally. There is no sort of a cookie cutter sort of response to, if you have it after 7 days, then call me. but more importantly is how it affects you. Sometimes some sleep issues, waking up, we tend to wake up once or twice a night, and that's normal. People are worried when that happens, but it's more than normal for people to wake up once or twice a night. The ability to fall back asleep again, that's important. Now, if you are up for 15 minutes, 20 minutes, let's say, but you're able to fall back asleep again, but it doesn't affect your mental health, your state of being the next day, then again, it's not so much of an issue. I wouldn't really address that immediately, unless, of course, it persists as well. So the severity of it, how it affects you and your rest of your life is important. The number two thing is also time. If it's been around for a couple of months or over a month, if it's not related to any sort of acute stress, for example, if you have job stress, or your child's going through an exam, or someone's ill in your family, if it's not an acute period, but it continues to propagate past a month to 2 months and so on, that's when you should seek help. And like I said, going back to the first one, is how it affects your daily life. Because if it affects your daily life, I had a patient who reached out to me within 4 days of having a sleep issue. And this was the issue I was explaining, which was her scheduling pre-COVID and post-COVID. When the lockdown had been reversed and relaxed in Georgia, she went back to work, but she had a lot of sleep issues because her sleep schedule had not really been set before work. Like up to that Sunday, she was still sleeping the way she normally did during the lockdown, where she had a variable sleep schedule. And on Monday morning, when she woke up, she was exhausted. Same thing happened on Tuesday, Wednesday, and she was like, I can't work like this. And she got in touch with me by a Thursday. So I think it differs for how the sleep issues affect you. I find another component to that is, as human beings, we tend to rationalize. I do that all the time. I do that every day, probably every minute, every day. And we tend to subscribe. So whether you're short of breath for when you walk up a flight of stairs, oh, I've just put on weight, or I'm getting older, and so on. I think we do tend to ascribe all these issues and rationalize it away. Or you're waking up tired, but then you're like relying on coffee, or you need a shower before you really feel awake. But understanding full well, when you fall asleep at night and if you wake up, and if you get the right kind of sleep and the right amount of sleep, you should wake up pretty awake, in terms of your ability to feel that you're alert and so on, and you shouldn't feel groggy. So I think a lot of this is actually being honest about how you feel, and how sleep or any respiratory issues affect your actual daily life, without trying to just rationalize it away, just going, it's old age, or it's just this, or it's just that, especially if it continues to propagate or perpetuate. So I hope that answered your question.
So one of the questions is about, could you address information overload? I am told that falling asleep suddenly is a stress response. What is the best way to combat that?
Switch off your phone. That would be the easiest way to do it. I would say go to reliable sources, in terms of where you get, I think Johns Hopkins has a great website for COVID related news. If you want to, I tend to stay away from US. I hope I don't offend anyone, but I tend to stay away from US related websites and news sites, because I think there's more hype than actual fact. I'm a big believer in BBC, so that's my personal choice. But I tend not to, I don't read any of my mom's WhatsApp messages on COVID, because I find that seems to be counterproductive. But yeah, so I think in terms of the stress and information overload, I think one thing is important is to try to avoid anything stressful about an hour before bedtime. If we find, now this may not work for everyone. Some people can watch things that are morbid and crazy on TV, and then you switch off the TV, they go to bed, within 10 minutes they're asleep. And God bless those people, lucky for them. And some people need an hour, half an hour to wind the body down. So I think in terms of, if you're feeling stressed, whether it's work related, whether it's COVID related, is to have that hour before bedtime that you try to disengage from social media, disengage from TV, try to do things that are relaxing, kind of get your body, mind into a sort of relaxed state. And it's important for us to pick, I think the one thing that I find is, human beings are very socially social animals, and they like socially acceptable times to fall asleep. They think everyone falls asleep at 10:30, so I must fall asleep at 10:30. So my winding down period must start at 9:30. But that's not really the case. You should really try to go to bed when you're feeling tired. when you're feeling sleepy. So that's why if you tend to fall or feel tired and sleepy by 11, then your winding down period should start around 10 o'clock, about an hour before, and ensuring that you get 7 to 8 hours of good sleep. So I hope that answers your question. I want to address another question by someone asked about how can telemedicine work for his orthopedic or who needs to check the healing of a fracture. So actually, they're doing that online already. A lot of practices are doing that to monitor healing. There are tools that they use in terms of how their video comes out and in terms of movement. So you can actually move around, and their screen allows them to see how the movement and see where the accuracy of the movement and the healing works fine. And so they're doing that. That actually is a build on to physical therapists that have been doing online physical therapy as well. And so working with patients to ensure that their mobility post-operative period is adequate. So I think for your orthopedic doctor as well is great. I think in terms of not having to go in for a visit and him having the choice, or him or her having the choice to go, yeah, your healing is not going as planned, let's bring you in. I think that's a huge thing. So imagine that you may save a large majority of your patients taking time off from work or loss of productivity that way, or not able to pick their child up from school because they have a doctor's appointment. And so just going back home, switching on the iPad and actually moving around and just showing the doctor how the leg moves and so on is huge. And in terms of how they're weight bearing and so on. So I think us as physicians as well, we need to adapt and change the way we physically examine patients. So that's something upon us. And I think we have to start changing our ways. And I'm glad COVID has forced us to embrace telemedicine, because now people have to be a lot more innovative and change the way they deal with patients. And you ask about endocrinologists as well. Your vitals can still be done via its CVS at Walgreens. You can check your blood pressure, you can check your heart rate. There are now technology for you to even check your temperature and so on, all within one product. There's these products online. I think there's one called MedWand, MEDWAND. But they're doing really innovative stuff in terms of how you can take all these vitals at home. But again, if you don't have access to that, you can go to your local drugstore or pharmacy and get that done. You can even buy it online and get it delivered the very next day via Prime on Amazon, blood pressure measuring cuffs and so on. So if you have any comorbidities or medical problems that need addressing, I think investing in all of those tools might be helpful. And you can relay that to your doctor and actually monitor that easily. So I think how we use technology and how we embrace telemedicine, I think is going to help us a lot.
I think you can go through whichever questions that you feel. We have 10 minutes more left. You feel whatever is.
Okay. Yeah, so there was a question, anonymous question about sleep apnea. Yes, it's more prevalent in men. And it does seem to affect men more at an early age. Women tend to catch up, unfortunately, after menopause. The estrogen or the estrogen hormone itself seems to be somewhat protective against sleep apnea in terms of its keeping your muscles of your airway open or stronger. But as women lose that when they go through menopause, they then end up having a risk as well for developing sleep apnea. The interesting thing is that women don't tend to have the same sort of manifestations as men do in terms of a loud snoring, sleepiness. Women tend to be a lot more subtle in terms of their snoring. It's not as loud usually. Some of them are loud, but most of them are not. The main complaint is not snoring that brings them in to see me. It's usually insomnia. So women tend to complain more of, I can't fall asleep, I can't stay asleep. And a lot of patients, too many patients I've worked with, have been on sleeping pills for years and years and years and years without actually figuring out, why do I need a pill to fall asleep? There are some basic ideas. You go to the toilet, your need for sex, your need for oxygen, your need for food, your ability to sleep. These are some things that we don't lose. And if you need a medication to help you sleep, you need to seek attention and make sure that you actually get a proper evaluation of, why do I need to pop a pill for me to fall asleep? So I think in terms of sleep apnea, its prevalence in men and how it manifests in women, I hope that helps answer your question. You did ask about COVID-19 and the mortality rate for men. I'm not sure. I think it's also an issue with comorbidities as well. I'm not sure the data truly is clear. And I think a lot of the information that we have out there is still murky. So I'd rather not comment on whether it really is affecting men much more until the dust settles and we have a better kind of a global view about how this disease affects, because even right now, when we say things like COVID-19 affects patients with diabetes more, it is not a blanket, it cannot be a blanket statement, because someone has mild diabetes doesn't have the same risk factor as someone who has really bad diabetes. So I think stratifying how bad your diabetes is as well may be an issue. So I think trying to figure out whether sex differences or gender differences may affect, I think we won't really know for sure until down the road. I was asked about in terms of well-being, would you recommend taking sleeping pills? I think I kind of answered that question as well. I think sleeping pills are a good tool to use short-term when you need it for example, if you have jet lag, if you have, a lot of times patients have issues even with the daylight savings time and your ability to adapt to that. Those acute situations, whether it's work-related, whether it's school-related, at times, if that affects your ability to function the next day, and it's really something that you can't seem to address short term, then using pills for a short period of time is a great way to get over that period. But it shouldn't be something long term. And I say shouldn't, and I don't mean that as a blanket statement as well. I have patients who have something called primary insomnia, and it's family related, or it's related, and I don't mean family related, but it's more genetic related, but also patients who've had this since they were very young and struggle with sleep, and they've tried everything. And yes, in those cases, long-term sleeping pills are useful in terms of helping them with sleep. But I think just popping a pill long-term to fall asleep without addressing what causes it. Again, there's all these different diseases that we are learning now. Sleep medicine is really in its infancy compared to a lot of other fields in medicine. And we're finding that, in terms of restless legs as one cause of an issue, sleep apnea is another cause that causes us not to sleep well at night. Different reasons in terms of our scheduling, the medications we take so many medications now more than ever, and we're learning how these medications actually affect our sleep. And we think, well, if it's a doctor prescribed, then it's a drug. But if I go to a Chinese sensei, or I go to a alternative medicine, or I go to an Ayurvedic doctor, that's natural. That's bullcrap. That's still a chemical that you're taking in your body. So, and that still has an effect on you. One is not any better than the other. I think alternative treatments are useful if it works, but to be cautious as well, because the difference is alternative treatments haven't gone through the rigor of scientific randomized control trials. And so you may be taking something that affects you and you may not be aware of how it affects you. So be cautious of alternative therapies. I think they work well, especially if it works for you. People take chamomile tea, people take melatonin, people take various kinds of means to help them fall asleep, sometimes especially if they're going through a phase where they can't sleep. And I think it's more so much a personal opinion rather than me telling you exactly what you should take at times. So what works for you is good. You shouldn't be taking it long term. If you start taking something long term to help you sleep, then you should reach out to a sleep physician.
Let's
Thank you,
have
Doctor.
a last round of
Raise the
questions.
clock.
Anything else that you want to cover? I think we have covered most of the questions in there.
Yeah,
This
there's
has been
another
a
one
great
here
session.
about a question about CPAP use and so on. Yes, I think if you have been using CPAP and you're comfortable with it, you don't need a repeat sleep study. There's no real reason to go through regular sleep studies. Now, again, if you're honest with yourself and you say, well, I was sleeping just as well as I did when I first started the CPAP many years ago, then that's great. Keep to that. If things have changed, then address that. Again, making sure that you're honest and actually understanding how that affects your life, because I think a lot of us tend to use busyness or have busyness as an excuse. I've got too much to deal with right now, I can't think of that, or I can't deal with that. But I think how sleep affects your even your executive functioning is huge. And that's where a lot of patients of mine as well are executives that have fatigue as a problem and productivity as a problem. And so you have ensuring that you're honest with yourself about how you feel and whether you're addressing some of the core issues that your life has, and not just saying, well, I'll deal with that down the road. I think it's important for us to address that, especially when sleep can affect us, increase your risk of heart disease and strokes and so on. And I think, again, bringing it back to COVID, we're seeing a lot of needless deaths right now. A lot of patients have died. The death counts just in the US are over 130,000. That's just a crazy number. And most of them have been elderly and people with medical diseases or health problems. So, stay healthy, ensuring that you address your health issues early on. This is not health issues, not something you deal with when you're older or when you're retired, but you need to address it right now. And so taking that seriously and making sure that you go back to the three crux of good health, good sleep, good mobility, and good nutrition.
Okay.
Thank
Thanks,
you,
Dr.
Doctor. This has
So
been a very useful and important session. And as I said to all our viewers, for additional information, please reach out to Dr. Avinesh Bhar. It's www.sliiip.com. It has 3 I in it. And with this, we would like to conclude our session and thank Doctor for his valuable time, as well as we learned something new through these webinars. As a community related organization, we are part of an alumni group and a network, and the word of mouth is really a strong recommendation. So there is help. Reach out for help and ask people and discuss these issues. And this is like a very critical point of time. And always we have rebounded back as a country, as a community, as a people in much tougher times historically. So this is just going to be a passing phase, but people need to reach out and ask for help. And there is like a support network that is out there professionally as well as through our alumni.
And I think a final note as well, I wanted to thank Vignesh and his team at Trillion Next. They did an outstanding job setting this up. I hope people have gained from this, and his digital marketing team, they have been outstanding. So thank you, Vignesh, for doing this, and everyone stay safe.
thank you very much. So we thank the opportunity as well as and also everyone for tuning in during these tough times. We hope our attempt to spread knowledge, connect, and share experiences helps everyone. So thank you, Dr. Bhar and Dr. Venkatesh, for sharing your valuable experiences. I at least learned some new things. Hope everybody else did. And also want to take a minute to thank Chicago Booth Zoom session team, Kathleen for helping us setting this up, and also Srini from California Tamil TV to kind of streaming it live. So feel free to reach out to Dr. Bhar, and everybody have a safe and good weekend.